In 2010, according to the World Health Organization, approximately 3.1 million babies died during their first month of life. In a neonatal intensive care unit of a hospital, neonatologists work with babies that are born with complications and illnesses. Today I'm going to talk to you about the role of a neonatologist in a hospital because I hope to one day become a neonatal doctor. I'm going to start off by telling you what a neonatologist is, where they work, and what their working environment is like. So, what is a neonatologist? Well, according to Brian Health, neonatology is a very highly specialized form of medical care within the field of pediatrics. So this means that neonatologists care for newborns and infants born with complications and illnesses. And this leads me to my second point. Neonatologists work in a special part of the hospital called the NICU, or the Neonatal Intensive Care Unit. And first of all, there's 3 different levels to the NICU. Levels 1, Levels 2, and Levels 3. Well, what do these levels mean? According to the American Academy of Pediatrics, Level 1 is your basic nursery. It is equipped to provide postnatal care for healthy newborns and to stabilize newborns that are born about 2 weeks early. Level 2 is a specialty level in which care is provided for infants weighing about 1,500 grams, which is roughly 3 pounds, and they're born at 32 to 35 weeks. So they're a little premature considering a normal baby is born about 39 weeks. So these premature babies in Level 2, they have prematurities. They aren't able to take oral feedings, and they have the inability to maintain body temperature. In Level 2, it is subdivided into Level 2A and Level 2B based on the hospital's capability to provide mechanical ventilation for less than 24 hours. So Level 2A hospital cannot do this, and a Level 2B one could. Level 3 is a subspecialty level in which care is provided for the most high-risk infants born with the most complex critical illnesses. It alone is subdivided into 3 different other levels because it is so complex. Level 3A is to provide care for infants weighing at 1,000 grams and who are born at 28 weeks. So they're very, very tiny. Level 3B is to care for infants weighing at 1,000 grams or less, with infants born at 28 weeks or less. So they're even smaller and they're even more premature. Level 3C is like Level 3B, except for it has the capabilities to perform surgical repairs on serious malformations of the heart. This leads me to my next point, where they work, or what the work environment is like, excuse me. So according to the Journal of Perinatology, there are 25 standards that an NICU should uphold. This is because the work environment of the NICU is very crucial to the newborn's survival and recovery rate. For today, for time's sake, I'm going to talk to you about the most important standards for newborn recovery. First of all, Standard 2 states that the NICU should be located relatively close to the birthing place of the hospital and that it be in a closed and controlled environment. Level 5 states that there should be an airborne infection isolation room to limit the amount of bacteria introduced to the newborns. Standard 14 states that there should be ambient lighting and that it should be controlled from 10 to 600 lux. Now, 10 lux is approximately the illumination of 10 candles held from a meter's distance. So as you can infer, it's not very bright. This is because no bright light should be permitted because it can hurt the infant's eyes and their skin. They're very, very fragile. Standard 22 states that the temperature should be kept in a range from 72 to 78 degrees Fahrenheit and that the humidity should be relatively at 30 to 60%. And Standard 24 states that the NICU should be in an acoustic environment. These standards are put in place because the infants are very, very fragile. Any disruption in their environment could cause them to have a lapse in recovery, and this is very, very bad, as they already have a small chance of surviving as it is. So, in conclusion, today I have talked to you about neonatology and how it is a special part of the pediatrics branch with an emphasis on newborn intensive care. I have informed you that there are 3 levels to the NICU and that the environment of the NICU is very crucial to the newborn survival and recovery rate. I hope you can see that neonatology is very important to our world. And because of advances in this medical field, the World Health Organization reports that neonatal mortality rates have been declining worldwide.